Like, hey, I came here to learn, but I'm here to tell you about our event coming up in San Diego. So, our guest presenter and is one of our partners at the Home Care Champions experience. And it's something that I'm really passionate about. And one thing that we've done is try to create a truly unique experience. That's why it's called the Home Care Champions experience, because it's different than how a lot of events are run. And so, what does that mean? It means that we're focused more on connection and collaboration. And so you're not going to be sitting in constant presentations throughout the whole event. It's really about there's opportunity for you to connect and talk with people. And that includes attendees, but also our amazing partners. And so that was something that I know a lot of our partners loved about the event, because you actually get time to build relationships with people and what we're offering. And we've got amazing guest speakers, partners that are going to be there. It's September 23rd to the 25th in San Diego, which who doesn't love San Diego? The sun is shining. So there it is. That's my pitch. Next up is introducing our incredible guest presenter today. She is a absolute wealth of knowledge, and she has a ton of amazing things to be sharing today. So without further ado, I would like to introduce the one and only Carmen Perry.
Well, thank you, Nick. I appreciate that. And I mirror his energy. I wish I could have the energy and bottle up Nick's energy in a bottle. I'd take it everywhere I go. But I absolutely adore him, and in this industry, there's people you meet and you immediately connect with, and you know that you can trust them, and, like, I feel Nick is that person, so I am always excited to see him around, and I will tell you, if you have not been to the Home Care Champions experience, I have, and it was incredible. For those of you that don't know who I am, my name is Carmen Perry. I have been in the healthcare industry for a very long time, but for the last 15 years, I have had the honor and the privilege of advocating for our nation's veterans. I sit on the board for the Certified Senior Advisor Editorial Journal. I serve on the Home Care Association of America VA Advisory Council, and I chair the National Aging in Place Council board of directors. So I stay busy in this space, but let's dive right in. First question I'm going to answer is, what is the RFP and what changes are expected? Now, the RFP is just a request for proposal. The VA pushed out in December a request for proposal to third-party administrators. Right now, we've got Optum and Tri-West that kind of have the country divided. Ultimately, Optum and Tri-West may still be in there, but we're kind of suspecting that they're going to have up to 5 different third-party administrators nationwide. That's a big deal for us, because right now, with just the 2, Optum and Tri-West in certain areas have said, "Hey, we have too many providers. We're not gonna sign anybody else up. We're not gonna credential." Now, I saw on the Kahoot that there were some of you in California, there were some of you in New York, some of you in Texas, some of you in Colorado. Colorado, what do I sound like my mother from Ohio. Colorado. However, every single state has hit the barrier of trying to get credentialed and being told, "Hey, we're oversaturated here." With this RFP, one of the biggest changes that's coming to every county near you is that there will no longer be a denial of credential due to oversaturation. So if you are currently providing care to a veteran through the Community Care Network, congratulations, you're already in the network. But if you are not, and you've been held out because of oversaturation, or you live in California and Texas where they're just not doing it at all, you are now going to have an opportunity to get into the Community Care Network. And not only are you going to be able to get into the Community Care Network, the new change is that credentialing will have to be completed within 90 days. So those people that were on those lists for months and years on end and going through this process that took forever, credentialing will happen for everybody, and it will happen in 90 days. Now, if you're currently contracted with the CCN and you are under Optum or Tri-West and they take a completely different third-party administrator for your area, you're going to have to get re-credentialed again. So that's going to come with hopefully some protections for continuity of care, but it's very important that you stay ready to go through a credentialing process again. Make sure your business license is up to date. Don't let that get close to expiring and then we find out, oh no, I've got to hurry up and get credentialed, but my license expires next month. Stay ahead of that stuff. Stay ahead of your insurance. Stay ahead of everything so you're ready to go when it's time to get recredentialed. Now, the other big deal is that they're reducing the VISNs, the locations from 18 nationwide down to 5. They're consolidating them. So things are gonna have delays as they do these transitions, and you guys just wanna stay ahead of it. Again, be ready for any changes coming your way. But what I can tell you is the RFP, they did extend the submissions to March 13th. So that's now been, oh no, to April 3rd. Sorry. It's been extended to April 3rd. Um, but the announcements of the awards for the third party administrators are expected in January of 2027. So you have a little time to get ready. But when we all know when those announcements come, we're going to have to be ready. So I think my friend always used to say, "Stay ready, so you have to get ready, so you always be ready." It's that something like that. Now, this is the number one question we got nationwide, no matter where you are. How can agencies get more VA referrals? Everybody has this question because they want more. Who doesn't want to provide care to more veterans? My first piece of advice to you is know your market. Understand how many veterans are actually in your area that need care. Now, my first recommendation to do that is go to va.gov and go into the state summaries of veteran demographics, where you can actually look and kind of see a heat map of all the veterans in your area that need care. You can see how many thousands are there. You can see what war periods they served in. You can see how many are enrolled in VA healthcare currently, how many are getting pensions. There is so much data there for you. But the first thing you're going to see is how many are actually in your area that need help. And you need to know that to know how much time you need to spend on this and really where you want to go to find them. Veterans are typically going to be in a few places. They're going to be at VFWs. They're going to be at care places where they can actually receive care. So they're going to be in the acute system. They're going to be in the post acute system. They're going to be at senior centers. There's places veterans go to congregate. So know your market. Know where to go to find them. Know how many that need care. Second, use appropriate channels to open up lines of communication. What I mean by that is if you're already currently providing care to veterans, one of the best ways to communicate with the VA social worker or the case manager is to let them know how the care is going. Give them updates, let them know if there's any change of conditions, let them know if there's any issues. I always say this, the good, the bad, the ugly. No matter what it is, we know in home care, it's not when something's going to go wrong or if something's going to go wrong, it's when. And when it comes down to providing care to a veteran, it's taken very seriously. So if something goes wrong, you want to be the first phone call to that case manager. Don't let them hear that from the issue from the veteran or their family. They want to hear it from you, and they want to hear what happened, how you solved the problem, and how you're going to prevent it from happening in the future. And that really is going to open up those lines of communication and really create a trust and transparency with those case managers and social workers. They'll know that if something goes wrong, they can count on you to solve it and let them know what happened. Next, be a solution. There are really challenging and high acuity cases when it comes to veterans. And if you're saying, look, I'll take those cases, we've got caregivers that can manage these situations. We did special training in PTSD or any type of Alzheimer's or dementia training or anything that you think veterans have a high chance of having. If you are a solution to those issues, they're going to refer to you. And then finally, providing exceptional care. Word of mouth is the number one way to get additional business. And if you've got a veteran telling their case manager or telling their primary care physician that they're getting this incredible care from you, I guarantee you that's going to circulate and you will just get additional referrals from the VA. Who qualifies for VA authorized in-home support? So really, this is going to come down to them being enrolled or eligible to enroll in veterans health care. So at the local VA or the local clinic, they if they're not currently enrolled, they're going to have to go through a process of getting enrolled into that program. But if they're eligible for VHA, they qualify. Second, they have to demonstrate a medical need. So if they're absolutely fine and don't need assistance at home, they're not going to qualify. And then finally, they have to have established a primary care physician at the VA. That is who's going to prescribe the in home support. So, enrolled in VHA, demonstrating a medical need, and having a primary care physician who can make that determination. How should families without VA authorization be directed? Now, I really liked this question for a couple reasons because number one, if they're enrolled in the VHA system, all they have to do is make an appointment with their primary care physician and explain why they need home care, either them or their family. If the answer is no, they're not enrolled in the VHA system, they're going to have to complete a VA 1010EZ form to get enrolled in the system. Now, in order to be eligible for Veterans Healthcare Administration, you've got to have limited income and you have to have served in the military, if anything but a dishonorable discharge. If they go and complete this 1010EZ form and if they already have a service connected disability, then that income, the limited income, does not apply to them. If you have even 10%, if you're rated even 10% of a VA disability, then the income is no longer applies to you, and anybody with a service-connected disability can enroll in Veterans Healthcare Administration. All right, next. What is the VA's policy on transportation? What do we do for real clients? Does the VA reimburse for this? And how do we respond to our veterans requesting this service? I have to tell you, right up next to how do I get the VA to send me more referrals, this was probably the second highest question because a lot of our veterans need transportation. Unfortunately, it's not included in the Community Care Network, HHA, or Homemaker or respite authorizations. They're going to either have to pay out of pocket or look at other benefits like aid in attendance, or I also recommend highly Area Agency on Aging. But this is really where you're going to have to lock arms with your community and find out what other benefits are available. Every single county has different transportation set up for seniors, and they actually do have different and additional benefits for veterans. So, as even though it's not included in the VA's program, there are programs, and I implore you to find them because I have never met a veteran on the Community Care Network that doesn't want transportation. It is a high need. My hope is that as they expand services in the future for veterans, they will begin to include transportation in the Community Care Network. We all know it's needed, so we can just keep asking. What if care managers limit veteran choice? So, this is a big deal. I consider this to be probably one of the biggest deals because ultimately, this is a veteran's right. This isn't a suggestion. This isn't something local VA can say, hey, I don't really feel like doing that. We have they're going to have to go where we tell them. That's not the case. This is a right. A veteran has a right to choose who provides their care. So if that is not being honored, number one, I would encourage you to have the veteran or their family reach out immediately to the patient advocate at the local VA. Every single VA has established a patient advocate. It's someone on site, on staff to advocate for the patient's rights. And veterans' choice is a right. Second, if that is being ignored or the family's not making any end rounds and contacting that advocate, I would encourage the agency to escalate this complaint up to the chief of geriatric care line. I ask you to do this because veterans' choice should not be ignored. It's their right. How can veterans be helped with VA paperwork? I think a lot of us feel the same way when it comes to wanting to help a veteran who's a little confused or lost in the paperwork process. I would ask you not to do that if you don't know what you're doing because veterans inherently have a distrust of the VA system. I've had veterans tell me there's no way I'm going to get help. The VA doesn't help me, and they just distrust the whole process, and they think no matter what they do, they're never gonna get what they need, and I would ask that if you don't understand the process of that they have to go through to get help with their VA paperwork, don't help them. Make sure you know who to send them to in your community for them to get help. Now, every single county, you can go on to va.gov and look for a local county VA accredited agent. They're most commonly referred to as veteran service officers, VSOs. They're in every single county. Every county has one. So no one here can't find one. You can go directly to va.gov and find that, type in your zip code, get your local VA accredited agents, and you can contact them to help you with the paperwork. Second, American Legion. They're everywhere. Every county has an American Legion, VFWs. They're very similar. They operate in post. Every single one of those locations has someone there that can assist them with VA paperwork. Now, if you're going to want to learn and understand the process, you can actually reach out to the local VA or you can go to a VSO and say, listen, I've got a veteran, they need help. Can you tell me what I can do to assist them? And they will direct you in the right way. What I don't encourage you to do is say, hey, you want to get signed up with the VA? Hop in my car. Let's go over to the VA and we'll figure this out. Most VAs are set up kind of like a campus. There's multiple buildings. There's just a lot to navigate. And if you've got a sick veteran in your car driving around trying to figure out, getting in and out of different buildings, trying to figure out where to turn in the information, you're not really helping. You're actually making things harder. So, my biggest suggestion is if understand the process first, know where to go, and know if to bring in professional help when it comes to assisting someone with their VA paperwork. Next, how do you appeal for more authorized care hours? Each VA operates differently, and anyone who works with multiple VAs, even if they're side by side or in one state and another state, can tell you this. They're gonna have their own process. So whatever VA you have, you need to understand their process. In some VAs, they want you to go directly to the primary care physician to increase the hours. So I recommend you contact the primary care physician. There's also VAs that request you go to the PACS team. There's VAs that request you reach out directly to the social worker or directly to the case manager. It is your job in working with the VA to understand how your local VA works. So take that seriously, take that responsibility and reach out and figure out what they need you to do to increase hours because that's going to come up. Veterans are going to have changes of condition. You're going to need to get hours increased, and you need to understand that process. Now, if you've done everything you can on your end and you're not getting anywhere, have the patient's family reach out to the patient advocate. The only reason I don't suggest you as an agency reach out to the patient advocate is because the patient advocate is for the patient. It's not for the provider. So they're going to get much further if it's the patient or the veteran or their family contacting the patient advocate. If someone has VA and Medicaid or Medi-Cal for my California folks, which pays first? So just 100% Medicaid, Medicare, Medicaid, Medi-Cal, always the last form of payment. So if VA is involved and Medicaid is the secondary payer, just know that VA is going to have to be exhausted first. Medicaid will always be the last payer. Please discuss the VA's Veteran Directed Care Program. Is the VA starting to promote this program at the expense of the traditional HHA and HM services? Now, this is a very good question because a lot of people didn't quite understand what Veterans Directed Care was. And as it started to grow and get recommended from the VA, they started losing clients and not understanding what was happening. I will tell you that this confuses some veterans as well because they start to think, oh, well, I can direct my own care. I can control my own care. Why not do this? And it's not a bad program. But if they go to the Veterans Directed Care Program, they are no longer going to be under the Community Care Network. So you will lose them as a client. But what the veteran needs to understand They are now going to become basically a home care agency. They're going to be in control of scheduling. They're going to be in control of paying. They're going to their caregiver. They're going to be in control of taking taxes out. I mean, they basically become an employer. And while some people have no issue with that and it's completely fine, if you've got anybody that's got even mild cognitive impairment or just not super organized or they're too sick to manage this, then I wouldn't recommend the Veterans Direct to Care program. Now, a lot of VAs are starting to recommend this, but I just would encourage you to have the full, transparent conversation with the client and explain to them the responsibilities that will now come on them as opposed to you. The other issue, and this is, I think, the biggest one, ultimately, if they're controlling a caregiver in their schedules and a caregiver calls out sick, there's no one else coming. So there are benefits to staying with the traditional home health care, community care network program. And I would tell you, I would say it's good for you to understand that so you can explain it to a veteran who's asking about the differences. Suggestions on how to build a line of communication with the VA. So there's this person who has an office who isn't interested in communicating with us, whose care managers are working remotely out of the office, don't respond to email or phone calls, and it's the VA Palo Alto, which that is a huge campus, and it can be very difficult. What I will tell you is that the majority of care managers are working remotely. They're not in the office. In fact, I maybe a handful across the country are actually in office. The majority of them are all not there. You can't market to them. You can't come in and tell them how great you are and all the caregivers you have. They're not there. The best way to open a line of communication with the care managers is to talk to them about the care. The care managers are responsible for managing the care. So if you've got veteran Smith who's got, had a great day and, who's experiencing a thriving life under your care, that is a good communication to open a line of communication with them. That's a great and appropriate way to say, "Hey, I want to let you know how this veteran's doing." Because as care managers, they need to report up how that veteran is doing. And if they can say, "Hey, under community care network, this veteran's actually doing really well. They're thriving, they're living, you know, their whole social life has improved." Those are ways to get them to open those communication lines with you. And again, like I said, the good, the bad, the ugly, you want to make sure that if there's any change of conditions or anything's gone wrong, you communicate with them. VA Palo Alto is very famous for this. And actually, it's not just Palo Alto. There's VAs across the country that are that way, but don't stop trying to communicate and reach out to them. Does a nurse practitioner qualify as a veteran's primary care to authorize services? So the answer to this is yes. There are some cases where the nurse practitioner is functioning as a veteran's primary care. You'll find this more commonly than not in rural areas or areas with limited access to care. I've found it in highly urban areas where they only have like a medical director and about 10 nurse practitioners under them that are acting as primary care as well. Um, but if they are acting as a primary care, they can actually refer them over to the community care network as well. So good information to know, good to have in your back pocket. Having trouble getting my vet's orders renewed, but getting nowhere with their social worker, and the community care network doesn't want direct requests from the agencies. And now there's a lapse in coverage. Any advice? Okay. So I've put this as our last question for a very important reason. Right now, this is happening across the country, coast to coast. There is no one immune from this, where veterans are, their authorizations are coming up for expiration. Agencies are proactively reaching out. So they're doing their job. They're saying, hey, 60 days from now, 30 days from now, we've got a veteran. Their service is about to expire. And they're not getting any responses. And the reality is, this whole system right now is a little overloaded, and getting a response is not always timely. And it is very possible that's a lapse in coverage is going to happen with more than one of your veterans. And at that moment, it's up to you as a business owner to make a choice. Um, are you going to continue to provide that care, knowing that veteran needs that care, but you may not get reimbursed for that care? Are you going to stop services, knowing that could provide a huge issue to a veteran who needs these services to survive? Can you get the family involved? Is there any way they can get involved in reaching out to the primary care or reaching out to the patient advocate to stimulate another authorization? Or are you going to escalate this request up the geriatric care line and see if you can get any supervisors to initiate an additional authorization? That is the business decision you'll have to make. The reality is, some of these authorizations are coming in much later than the expiration, and they're not being dated retroactively to that original authorization's expiration date, which means if you continue to provide care after that expiration date and between the time you got that and the new authorization, it's very possible that those days of coverage won't be reimbursed. So it's very important to make that business decision. I would encourage you to make that choice prior to this happening so you guys know as a business what your plan is and have a plan of action. I also encourage you to contact anybody you can at the VA to hopefully prior to that authorization expiring contact you and find a solution, because we know that if you're not providing care, that means the veteran's going without help. And that was our last question. So we can actually look into the chat and see if there's any questions. I guarantee there are, because this is just one of those subject matters that there's always questions.
I love how active and engaged everyone was, and I know there's a lot of different questions here, so I just kind of want to reignite the questions here. And so as you guys are putting in your questions, one thing I wanted to mention that I think is really important, especially from the marketing side of things, is how we leverage and utilize social media to create more awareness about veterans and these benefits. And so I had one example of one client where we made a video together about just like all these veteran benefits that exist, and she boosted it on Facebook. There were so many people that commented like, this can't be real, or like, is this real, right? They're like, if this is real, people need to know about it. And so it's just a great example of how many people are not aware of these benefits, and it's up to you to bring more awareness around these things. And so if you want to get one, bring more awareness to the benefits, creating content around it, sharing about it is one way, but then also, you know, making sure that you are uh explaining kind of and helping them through potentially the process. And that's something that we would do with our clients is like some agencies, I'd be curious to hear, Carmen, what you, some people were like, well, we serve veterans, but then there's other people that I have that actually like walk the veterans through every step of the process and handhold. And so I think that's another question that you mentioned, right? You had some questions to decide on like what company that you want to be, because there's some that are willing to take that time and really do the work. But the more that you bring awareness, create this content out there, the more that you're going to be able to help, as well as getting these veterans the benefits that they deserve.
I agree. There's so many places you can go locally just to kind of link arms and learn the process if you don't know it. I know there's a lot of people right now that are getting credentialed and they're like, where do I start? What do I do? How do my best advice to you is go connect with a veteran service officer in your area. They're county employees. They actually don't work for the VA. They're county employees. So they all work for your counties. They're local, they're in your local community. Half of them are your friends. So go connect with them and educate yourself on what's the best process in your town, because every town's different as far as, where to go, how to turn the paperwork in. You can call on the phone, you can do it online, you can walk it in, you can mail it in. There's different ways you can get somebody connected with the Veterans Health Administration, but I would say connect with the local VSO if you're just getting started and trying to identify who's a professional in your area that you can trust. And you can find that on va.gov. Um,
Can you see the questions, Carmen?
I can. I see
Okay.
Harpreet. asked if how will we receive an email if we need to recredentialize? You will get an email. And it's very important that you pay attention to that email because they're not going to send a bunch of them. And so you want to make sure that whoever did the credentialing, that email is the one that's up to date with your third party administrator, whether it's TriWest or Optum. But they'll typically send you a notification about 90 days in advance. Recredentialing is required every 3 years. So just so you have an idea of your mind of that time frame. If you currently work with Paradigm, we will be on top of that. So you don't have to worry about it. Oh, thank you, Weston, for answering the Vision question. Weston's so cool.
I know, I love Weston. I glad to hear when I saw his name, I got excited that he was on here.
Does the vet have to give up their existing PCP? No. So if a veteran has a primary care physician, and I always say civilian because I'm a law enforcement family. If it's a civilian primary care physician, they can maintain that primary care physician. But if they want to get a community care network referral for home care, they're going to have to get a VA. Primary care physician established. They don't. That doesn't have to become their primary care. They just have to get one established for the purposes of getting referred to home care services. Can providers offer transportation at no additional cost while working under the VA authorizations, HHA, HMK, respite? Ooh, Shelly Nutter for a great question. No, you cannot provide transportation while you are working under those VA authorizations. So let's say you're authorized for 10 hours a week for helping Veteran Smith. During those 10 hours that you are providing those services, you cannot put Veteran Smith in a car and drive him to your doctor's appointment. What you can do is drive them outside of those authorized hours. With those hours, you'll notice that there's typically some requirements around that. Usually it's like personal care, personal hygiene, like it's hands on care with the veteran. Homemaker has a little more extended services, but transportation is not included in that. So you cannot drive them while they are under that authorization. But outside of those hours, yes, you can actually provide transportation at no cost. And if you do that, that's super nice. All right. Does a VA doctor ever do a home visit or telehealth visit for the first appointment? Ooh, Beth O'Connor with a question. The answer is no. They don't. Not from my experience. They had a brief period where they had a lot of the telehealth visits during COVID, but it wasn't for that initial one. And I know you're asking that. I know why you're asking that. But no, it's not for that initial appointment. They typically want to see you in person. They want you to come into the VA. They could do a full assessment. If I find out if there's exceptions to that, I will definitely let you know. All right. VA's offices are tremendous help. What is the best way to thoroughly understand complete VA process? Harpreet, if you mean like the VA process to understand how to navigate it so you can explain it to a veteran, then what I said earlier about connecting with a VSO is going to be a really good way. I also recommend, depending upon where you are, go to the VA campus yourself. Try to navigate it yourself, and you will see what our veterans do trying to navigate it. But number one, number two, you'll find out which buildings are for what, because they are typically pretty separated and divided, and you are going to have to kind of figure out how to navigate it. And if you can do that first, then you can tell a veteran what they need to do. Like when you pull up to VA, Palo Alto, you're going to make a left and then there's going to be a parking lot and then you can go straight in that building and submit your application, that kind of stuff. Figure it out yourself. Go up there. Don't be afraid to immerse yourself in the VA culture at the local VAMC. How do we start in service for VSO office or something else? So I don't know that you will actually be allowed to do in service with the VSO. Like I said, they're county employees, so there's a lot of restrictions around um, solicitation to that type of agent. You can educate them that you're a home care agency that's contracted to provide care to VA, and or to veterans, and that if they have any veterans coming in searching for and don't know where to turn to, that you're happy to assist them with that process. That's an education piece, and I think that you can absolutely educate them on what services are available and introduce yourself. Like I said, these are people you know, they're in your communities. So I would encourage you to introduce yourself to them, but as far as, like, a lunch and learn or anything like that, they can't accept anything, like, any kind like, not even, like, flowers or gifts or any like, yeah, spa days. They can't really accept those things, so be very careful. When it comes to veterans, you cannot solicit at all, and, them, not agents, not anybody. What you can do, and what I encourage people to do, is to educate them on what's available and inform them on where they can go to access care. You can educate, inform, and advocate all day. You just can't solicit. So be careful with that one. Okay. Let's see. Does the veteran need to give up their oh no. Oh, that was the same question. VA
I
home-based primary.
I do have another one here, Carmen, that kind of came through the Q&A box. We are authorized to care for vets, but have never received a client. How can we get started with them? We have had many vets go to the VA, but we don't get them back as clients.
Ooh.
That's a great
Um,
question.
Depending upon where you are, you might wanna reach out to the local VA MC and find out if you are actually showing up in their system. There are some cases where someone is credentialed with TriWest or Optum, but they're not actually showing up in the local VA caseworker system. So if a veteran goes, "Hey, I want, home care agency A," and caseworker goes in and says, "Hey, that agency's not here," but you're credentialed and you should be showing up in their system, then there could be an upload issue or a connection issue that needs to be resolved. Because if you're not showing up in the VA system, they can't kick out a referral to you. Um, but it is a big deal that you send a veteran to the VA and they're not sending them back. So, a couple things. One, you want to make sure that the veteran is clear on the name of your agency when they go there and they're requesting your name and the name of your agency when they are asking for home care. Make sure they're clear. Either they can have a business card of yours, they can have a flyer of yours, but they need to have your information, um, because once they state that to their primary care or to the case manager or their social worker, that gets entered into the electronic health record. So it'll be in there. Um, Number two, make sure that you are in the system. So even if you're sending them in there with your information and they're communicating that, if you're not showing up on the VA system, they're not going to come back to you. Now, if they are stating your name and you're in the system, and the veteran's not coming back to you, make sure that family reaches out to the patient advocate because, as I mentioned earlier, that is their right. Okay. Whew. Okay. Can you walk me through the full VA credentialing process from application to full authorized patient, including the typical timeline, common delays, and what separates agencies that get approved faster from those that struggle? Ooh, Lewis, that is a heavy question.
It's a very I don't know if that's a on here question. I'll let you navigate that, Carmen, if you
Yeah. What I will say is that credentialing right now is a little disjointed. Um, the majority of agencies trying to get in this system are being denied access due to oversaturation. So that's one of the biggest delays I think is happening. Um, from application to authorized patient, it's hard to give you an average of that because it varies so much. Um, so what I will tell you, Lewis, is reach out to me. I think Nick put my LinkedIn on there. Shoot me a message and I'll see if you can I can get connected with you and find out your area and give you kind of a better localized response to that question. What is the
excellent.
cap of max hours for veterans that are not compensated? What is the cap max of hours for veterans that are not compensated? You know what? If I don't know. I'm not that are not compensated like service connected or not compensated like retired pension. Just text me, Jeff. I got your number.
I got another question here from Jay. I was just credentialed, question mark. So maybe he's not sure if he is in Alabama, effective 5/1/26. Our main service area is in Northwest Florida, right next to our Alabama area. Can you confirm that once I am approved to start providing care for VA, my entire service area, including Florida, is qualified? In other words, there is a wait list for my county in Florida, but no wait in Alabama. Will my Alabama approve allow me to serve Florida veterans? I can, if you're not seeing this, let me
So,
see if I can.
yeah, no, um, it's what my understanding is it's state to state. So, if you're approved in Alabama, even though your area fully covers into Florida, Florida may not you may not show up in the Florida system. So, in order to extend that credentialing, you're going to have to reach out to the local VAs that are in the areas that you cover and let them know, like, I'm credentialed here under this state, but I cover all of these areas and give them your zip codes. They can add that, but I haven't heard any major success in continuing to get referrals from that area. So you're credentialed in Alabama, that's really going to be where that's gonna be like your home state. In order to extend your credentialing to Florida, you would have to open a physical office in Florida, if that makes any sense. All right. Well, we
Excellent.
seriously had a great time today. I know that it kinda rocked through pretty quickly, but I really hope I gave you guys some answers. Again, feel free to reach out to me anytime. I am happy to answer any questions I can for you, and if I don't have them, I will find them. And I really appreciate this chance to connect with you all through Nick, and I hope I see you in San Diego, sunny San Diego, coming up soon here.
Love it. Yeah, thank you, Carmen. No, I think the timing worked out. You got through a lot of your, common questions, and then we were able to answer the attendee questions, which is perfect. So again, if you have additional questions, definitely reach out to Carmen. Um, the event is in September 23rd to the 25th. I just want to again thank you, Carmen, for being amazing. So, thank you all for being here. Yeah, we hope to see you in sunny San Diego. It's going to be an amazing event. And we appreciate you all. If there's anything else that you need, feel free to reach out to me or Carmen. We're here to help support you in any area that you need. So, thank you so much for your time. And hopefully, we'll see you on the next one.